First is the gracilis. It is a thin superficial tendon on the anteromedial thigh. So here's our anterior medial with knee flexion. So we'll kick it up and resisted adduction, just posterior to adductor longus and medial to the semitendinosus. So coming down here to our knee. Next is the sartorius. Sartorius, so in our supine position, down. Located proximally just medial to the tensor fasciae lata and lateral to the iliopsoas. You palpate superficially from the anterior superioiliac spine to the medial tibial condyle during combined resistance of hip flexion, external rotation, abduction, and knee flexion. So here's our knee flexion up here by our anterior superioiliac spine, and then downward to the medial tibial condyle. Next is the gluteus maximus. We're on the posterior side of the body, and it runs downward and laterally between the posterior iliac crest superiorly, anal cleft medially, and the the gluteal fold inferiorly. And then if we were in external rotation and abduction, kicking out away from the body, or I think, yeah, out away from the body. And then our gluteus medius, superior to that, it's slightly in front of and a few inches above the greater trochanter, opposite pelvis from a standing position. So here we are, standing position. We're going to go into abduction. So here it is, just above that gluteus maximus up here. And then also with that is the gluteus minimus, which is deep to the gluteus medius. It is covered by it covered tensor fasciae lata between anterior iliac crest and greater trochanter. And we're also going to be in abduction, but internal rotation. So here it is here. Slightly in front of that greater trochanter. Or, no, slightly deep to the gluteus medius. And then the biceps femoris, postero, so here's our posterior side, lateral, nope, keep it on the back, aspect of distal thigh. So we're down here, combined with, so knee flexion, just distal to the ischial tuberosity, with hip internally rotated. Okay, so here's our active knee flexion coming down from here and then across laterally down to our knee.